Even on a very warm day like this or otherwise, it's always important to take steps to stay healthy, especially during a pandemic, right?
Yeah, without a doubt. And that includes mental health, right? And we want to go to our health reporter, Haley Hernandez, who is joined by one of those health heroes this May, a doctor who has some tips on how to take care of our mental health. Haley?
Right, because during the pandemic, mental health really became a mainstream topic. And here in Houston, we remember that COVID showed up just a few years after Harvey had really traumatized our community. And after Harvey is when I first met Dr. Asim Shah, talking about stress in the community and among our children. Dr. Shah, who works for Baylor College of Medicine and is the chief of psychiatry at Ben Taub, is joining me now. And Dr. Shah, I was just at a luncheon where you were named an honoree of the I'm a Hog Award. And to summarize for our viewers what that means, it means you're really a prize to the mental health community and to us here in Houston. So I appreciate you joining us. There's a reason that I chose you as our healthcare hero to talk about mental health. But tell me about the state of mental health right now. I mean, we're coming out of the pandemic. This has been a hard few years for people. What can we predict is going to happen?
Sure. First of all, thanks for inviting me. Really appreciate it. You're right. It has been a hard few years, and it has been a roller coaster. We started with phobia, panic, depression, anxiety, PTSD-like symptoms, and now we have something called overload of socialization. People are socializing way too much, and some people cannot handle it. So we have a different kind of issue for some people. It's a little bit of overload of socialization, and people are getting a little burned out because of socialization. Something which we were lacking into 2020. It is a little bit of overload of that.
The opposite direction.
Exactly, complete opposite. So that's the reason I say it's a roller coaster right now.
So what's your prediction on are we going to be able to get over this? How are we going to be able to level out and really come to a healthier place mentally?
You know me, that I'm a very positive person.
Of course, yes, that's why I love to hear from you.
I think we will be able to get over it, absolutely. But we need to be careful about certain things. Like, for example, it was never a good idea to not socialize. I always said social distancing was never a good sentence. We should have used the word physical distancing. Same thing now, that we should not do too much socialization. We need to select days of socialization. Weekend is fine, but weekdays is not. So have some gaps. Same thing that people are very resilient. Human beings are very resilient, and we need to be very careful in terms of burnout. Everybody's stress level is different. Everybody needs different kind of rest. So we need to be careful of what amount of rest your body wants, and we need to do that accordingly. So take different amount of rest and give your body rest what your body wants.
What I hear you saying is something we heard a lot throughout the pandemic is self-care. Take that time for self-care. Even if you are starting to go out more, still make time for yourself at home.
But if you go out, come back early.
Yeah.
So don't go out late on Sunday.
Easier said than done, Dr. Shah.
I don't do it either sometimes. So.
I have one last question is, do you recommend those apps that became popular during the pandemic? Talkspace, BetterHelp,
Absolutely. I recommend it all the time because those are help. People these days are on social media. Nobody wants to go to see a doctor all the time. So for mild symptoms, not for severe or moderate, but for mild symptoms, apps are very good. A lot of them are free. Some of them are very low cost. Absolutely use them for mild symptoms. But when your symptoms become moderate or severe, go and see a professional.
Mild symptoms. Thank you, Dr. Shah. I appreciate that, especially since, as you said, people are comfortable trying something on their phone that they might not want to go out and see a doctor for. I appreciate your time. Thank you for being one of our local healthcare heroes.
Thank you.
And Keith and Christine, I'm going to send it back to you.
Yeah. Oh, wow. Such important tips to remember.
Yes.
Yeah, Haley, thank you so much, and thank you, Dr. Shah.